because I know he said that he's been called in by quite a number of the doctors in this area to work on their intractable pain patients. Now, what about recurrent states not in evidence at time of examination? It's the third type with which we work. It's one thing if the patient comes into you with a migraine headache or an asthma attack or an allergic reaction and so on. But suppose the patient doesn't have the migraine headache or the allergic attack or anything else, or the asthma. Comes in and says, "Doctor, I get the darndest headaches every once in a while." Now, what would be your normal course of procedure? You'd put him through every type of test imaginable, and after all the tests were in and the reports were negative, and you couldn't find the cause for the headaches, what would you have to do before you could help the man? Wait for an attack. There isn't much you could do in the way of building him up or giving him medication that would prevent an attack, because anything you give him wouldn't prevent an attack. But in hypnosis, how differently we work. We don't have to wait for the attack in hypnosis. We know that anything that can be produced by suggestion can be removed by suggestion. So we precipitate a migraine attack in hypnosis and then take it away, and then teach the patient how to bring it on and take it away. And once the patient can do that, he's in control of his own headache or his own asthma. And from that time on, he's able to banish the headache instantly by autosuggestion. And you've heard several of the men tell you how quickly a headache vanishes. Well, it vanishes just as quickly by autosuggestion, so you teach the patient autosuggestion to handle it. You'll see how that negative-positive approach in hypnosis works perfect wonders. And I think you've heard some of the doctors in this area talk about it. In the midst of an attack, superficial suggestion works wonders, but if the patient is not in the midst of an attack, proceed as instructed, first using the negative procedure, then the positive. Anything which can be produced by suggestion can be removed by suggestion. Convince the patient he can relieve himself thereafter by the use of auto-hypnosis, and teach him the auto-hypnotic technique. We'll go into that as we proceed. The fourth category is where future analgesic need is indicated. The expectant mother is an excellent example. And right now, gentlemen, with what you have learned in hypnosis, you are now prepared to take a woman through a major portion of active labor and almost to the point of delivery. And if you hit certain cases who go very deeply under with the little urging that you do at this point, you will be able to carry them completely through. In fact, I think some of you have carried them almost completely through. I think I had a couple of reports right here in this group. But from this point on, you'll be able to do a lot more than you have been able to do, because now you're working with a deeper state of hypnosis. The fifth category, psychosomatic syndromes or other forms of neuroses. How many physicians have had patients with symptoms so confused that they resemble no known illness and respond to no known therapy? Is there any doctor here who hasn't had that? The patient with a confused syndrome, I call it, the syndrome that doesn't make sense. You cannot add the symptoms together and make a syndrome. How many have encountered such patients? Is there anyone here who hasn't, who's in medicine? You encountered them? You encountered them, doctor? Anyone who hasn't? How about the physicians and dentists who have had patients who hold on to pain even after anesthesia is administered? This happens in the dental office sufficiently often so that I doubt if there's a dentist in this room who isn't aware of it. How many times have you infiltrated in exactly the right spots, gentlemen, and then the patient is still not anesthetized? Plenty of times. Is that right, doctor? And physicians have done the same thing. You go to give a child, we'll say, anesthesia for a tonsillectomy, and you give that child all the anesthesia that you think is perfectly safe for that child, or that the anesthetist thinks is perfectly safe for that child, and you still haven't got the anesthesia. How many of you have done? Doctor, you've done surgery. How about that? Have you hit into that? This is the most important group of all those we work with in suggestive therapy. People who hold on to pain or hold on to symptoms, whether they are dental or medical patients, require an almost entirely different type of handling. When fear alone is the cause of holding on to pain, sometimes superficial hypnotic therapy is beneficial. But where fear is only one of the many factors, you must get at the causes before you can expect to give lasting relief. This type of patient requires hypnoanalysis. And that's why we gave you those records to play and to play again and again, so that you learn the ways that these people develop illnesses, and how your own patients develop illnesses, and how you can help those same patients. Now I'd like to talk to you for a moment on how suggestions take hold. Suggestions always take hold in one of two manners, either by instant reaction or delayed reaction. And some of you had delayed reaction right up here. How many times were you given suggestion? How many of you were given suggestion? And instead of the hand numbing instantly, or whatever area was anesthetized, it took about a minute or two for the anesthesia to work its way in. How many of you had that experience tonight? Nobody? Did you all get instantaneous anesthesia? Couldn't be. Pauline, did you hear what I said? Did everybody get instantaneous anesthesia? Okay. You'll generally find the patient who gets anesthesia, well, for example, the dentist will infiltrate with suggestion, and the suggestion will be taken instantly. Then he will give another patient the same suggestions, and when I say infiltrate by suggestion, I mean he will touch the needle to the jaw and tell them that now they're going to have complete anesthesia, and the patient believing it gets it, but another patient believing it just as well as the first patient doesn't get it for several minutes. And when the dentist says to the patient, how's the jaw? Is it numb? The patient will say, mm-mm. And he'll say to himself, well, I guess I'll have to give him a xylocaine. And he gets the ampule all prepared, and he's ready to infiltrate now with the real stuff. And he says to the patient, how's your jaw now? And the patient says, oh, doctor, it's so numb. That patient has had a delayed reaction. Watch for it. It happens in every phase of hypnosis, and I want you to know about it. I'd like to discuss for just a moment the superficial therapy of hypnotic suggestions. Many people claim that hypnotic suggestions give only symptomatic relief. These claimants are entirely right, and I am on their side, for they have been able to give only symptomatic relief. Many people, however, claim that hypnotic suggestions give lasting relief and in many cases affect actual cures. These people cannot be discounted lightly. There are too many of them. Perhaps these people who claim more lasting benefits know more about the subject than those who claim only symptomatic results. It's a never-ending controversy. Let me tell you what I mean by that. The other night we had a man in St. Louis or someplace in class, and when I told him that I believed that hypnosis had never cured anything, he says, I don't go along with that, Mr. Elman. I've been using hypnosis for many, many years, and I think that if you hypnotize a person, they develop another emotional reaction to the stimulus. And now they don't react to situations the same way, and consequently you get a perfect cure without doing anything but the hypnosis itself. I have never found it that way in my lifetime. That's why I get into arguments like this with another student. Student comes to a banquet where I have been invited, and we have seats on opposite sides of the table, and he says, oh, Dave, it's so good to see you again. And as we get to talk, he says, still believe that hypnosis never cured anything? Yeah. Till I see proof that it's cured something, I'll always believe that way. And he says, you know, you're a funny duck. And I said, in what way? He says, you apparently don't have respect for the knowledge of a doctor. And I said, oh, that's silly, Joe. You've been my student. You know that I only teach doctors, and if I didn't have respect for the knowledge, I wouldn't teach them. And he says, well, apparently you don't respect my knowledge. He says, don't you respect knowledge of a man who has his boards in dermatology? I said, what do you mean, don't respect your knowledge? Well, he says, look, I took your course 3 years ago, and you know I use hypnosis a lot these days. I said, yes, I know that. All right, here comes a patient who has neurodermatitis from head to foot, totally covered with it. Eyes blinded by the pus. He can't see, and he's in agony. Using only what you taught me, nothing else, no hypnoanalysis, nothing, just the hypnosis and teaching him to relax, I cleared his body so that not a sign of the neurodermatitis was in evidence. He was able to see as well as anybody, recovered 20/20 vision. He hasn't had a recurrent symptom in the past 3 years. Are you trying to tell me that I didn't cure that man? And I said to him, no, Joe, I'm trying to tell you that I have no evidence that that was a cure. You may have cured him, but I don't regard that as a cure unless I know that that man could encounter the same emotional circumstances which precipitated that neurodermatitis the first time and not have the same reaction from the emotional causes which precipitated it the first time. This may be contrary to what some of you think. This course does not teach that hypnosis is a panacea nor a cure for anything. It merely teaches you the art of suggestion so thoroughly that you're in a position to make your own decisions from your own case histories. We don't ask you to forget what you've learned about medical or dental procedure. We merely give you a valuable therapeutic adjunct and ask that you use it as an adjunct to your regular procedures. All right, Pauline, will you pass out the outlines and everything else? And I will bring the class to a halt. The difference between waking suggestion and waking hypnosis. Now, the textbooks mention these two states, and then they completely get away from them so fast that you know darn well that they don't know very much about the states, or at least how to produce them or something, for they just desert them almost as quickly as they mention them. But the fact that these states are known, oh yes, but there is no place in the world outside of our classrooms, that is this course, where waking hypnosis is taught. And waking hypnosis can be one of your most valuable allies in medicine or dentistry. In fact, it is my firm belief that no man can know hypnosis without knowing waking hypnosis. When we first began teaching, my ideas about waking hypnosis were simply this. Well, here's a phase of the subject that the doctor probably will never be able to use, but that he should know the state and know that it is possible to obtain the state and know that he can use the state if he wants to. That should be academic knowledge for him, at least. Soon after, however, when we began teaching it, we began to find that this is one of the most valuable of all the techniques in hypnosis, the one you are going to learn tonight. Don't sell it short. On the other hand, once you have learned how to use it, I don't want you to oversell yourself on it. For this is the session at which any old student will tell you the trails divide for some men. Some men will go in the direction of waking hypnosis and become so adept in its use that they scarcely ever need to go for the trance state. Others will forego waking hypnosis entirely in favor of the trance, and they're making just as much a mistake as the first category. For those who forsake the trance state for waking hypnosis are making a terrible mistake in my estimation. And those who go so much in the direction of the trance state that they forsake the waking stage are certainly ill-advised. The true use of waking hypnosis should be this, or the true judge of its use. But when you find resistance to the trance state, use waking hypnosis. You'll get your results just as well. Where you are trying to save time, use waking hypnosis. You'll get your results just as well. But where time is not of the essence, you will find that in the long run, the trance state will serve you well, and perhaps even better, for many purposes, than the waking state. Now, I told you that I would first let you see the difference between the two states. Here's your definition of waking suggestion. Waking suggestions are those suggestions given in the normal state of consciousness which do not precipitate a waking state of hypnosis. For an example, someone in the room yawns. Somebody sees him yawn. He yawns. Another person sees him yawn, and the third person yawns, and pretty soon you have a room full of yawning people. That is not waking hypnosis. That is waking suggestion. Every one of us has seen this occur. There is no bypass of the critical factor involved. Those people merely yawn because they felt like yawning. That's all. Another form of waking suggestion is this. I might say to you, Doctor, won't you be seated? Or, come in, Mrs. Jones. Either of those statements are waking suggestions. There is no waking hypnosis involved at all. But now let me show you the difference between waking suggestion and waking hypnosis. When hypnotic effects are achieved without the use of the trance state, such hypnotic effects are called waking hypnosis. Now let me show you an example of waking hypnosis at work. You've never been here before, have you, sir? All right, would you come up, please? Doctor, would you remove that, please? You can put it on the floor any place, just so that... that wouldn't matter. Doctor, you like to go to the dentist? Or you probably don't any more than anybody else does. All right.
Anytime.
All right. Watch this. I'm going to stroke his jaw 3 times. And you will lose all feeling in this side of the jaw that I stroke. 1, 2, 3. And now will some men in dentistry come up here, please? And you are going to find a most amazing thing has taken place. Who's in dentistry up here? Are you in dentistry? All right, take any of those instruments at all. Go inside on the right side of his jaw, and you won't be able to find any feeling there whatsoever. This will astound you.
Sure?
Well, you wait and see. Now watch this. I just want you to watch it because I think the man here is going to be amazed because he's in anesthesia himself. Got perfect anesthesia, right?
Thank you.
How about it, Doctor? What'd you feel?
What did you do?
What did he do?
You should have felt that.
He gouged you hard enough so that you would have hit the ceiling, Doctor. That's what he went in with. No, thank you. That's all I need you for.
How long did this last?
Well, that would last as long as you needed to be in the dental chair. It would last for 2 hours, 3 hours, 4 hours, as long as he had to work on you. And I can assure you that it's just as good anesthesia as you would get with xylocaine or anything else. He's never been hypnotized. And yet here was a hypnotic effect achieved without the use of the trance state. Now, I'll explain how I did that. After all, I must have known what I was doing. I take the very man that would be most apt not to have anesthesia in this chair, an anesthetist, who probably thinks that hypnosis is a lot of rot to begin with. He's never been hypnotized. He comes up here, and I stroke his jaw 3 times, and he has no feeling in the jaw. I must have known what I was doing. Is that right? I couldn't have done that by accident. Yes, Doctor? I think right. You got anesthesia, as I said that?
No, I actually got...
Oh, you actually have a...
anesthesia from local injection. My tooth was on today.
Oh. Do you want to anesthetize the other side?
Yeah.
Come on. Now, I want you to see this. I'm going to prove to you, if he just has had anesthesia on one side, I'm going to prove to you now that hypnotic anesthesia can be even better than chemical anesthesia. Watch this. And I want you to make a test on both sides, whoever comes up here. And watch this. I'm going to stroke your jaw 3 times. This side isn't this side. All right, we'll do it on this side then. I'm going to stroke this jaw 3 times. You will lose all feeling on this side of the face. 1, 2, and now that jaw will be completely anesthetized. 3. Now, who else is in dentistry? There must be someone else in this group that's in dentistry. All right, Doctor, would you come up, please? Go inside, and I want you to work on either side, because he's got anesthesia, chemical on one side, hypnotic on the other. See if you can find any difference. Pick out the best you can. Just there. Make a test there first, then, Doctor. Make a test where I anesthetize. See what you like the best for your anesthesia.
Okay, we'll try the lower left side of the part you anesthetize here.
Now go to the chemically anesthetized and see.
Yeah, there's more feeling up here where the part.
There's more anesthesia, more anesthesia from the hypnotic anesthesia than from the chemical anesthesia. And now that's a doctor in class. So, Doctor, you tell him. Or would you tell him that, please?
Well, that's true.
No, so that any of you that want to sell waking hypnosis short, you can do so. But those of us who know waking hypnosis and know how to use it know the power of it. For that anesthesia that he gets is complete and entire, and it's better than a chemical anesthesia. Let me show you waking hypnosis from another standpoint. I think the gentleman back there, you've never been here, have you? The one right there, the one with his hand to his face like that, have you ever been here? All right. You don't have to come up. You can but do stand up so that I can see you. Would you give us your name and address, please?
James S. Boyle, Home City.
All right. Dr. James S. Boyle, what branch of medicine?
Neurology.
Neurology. Urology. All right, doctor. I'm just going to do something now. I am going to ask you to, when I snap my fingers, give me your name and address. I will snap my fingers again, and you'll find that for a short time, you won't be able to think of your name and address. Now watch this. First, you'll be able to give me your name and address. What is your name and address?
James S. Boyle, Home City.
Now watch the odd effect. For now, you won't be able to say it. Now try to say your name and address, doctor. You'll find it's gone.
James S. Boyle.
All right. All right. That's a rejection. So thank you. You can sit down. It failed, and there's no use trying to tell you that it succeeded, because you saw it fail. He did not want it to happen, therefore it did not happen. Now, let's take the gentleman back there. Want this to happen, sir, and you'll find that it will happen completely, and you'll know that you're doing nothing to help make it happen. Give me your name and address, please.
Dr. J. Sugarman, Oak City.
All right, I'm going to snap my fingers, and you'll find that you can't think of the name or address. Try to say it now, and you'll find it's gone. Try hard. All right, now you can say it. All right. Now, why did it work there, and why did it not work there? Because he was going to show me that it wasn't going to work. Is that correct, doctor? Is that correct? You who are in urology, is that correct? Sure. Now, the other man, I said, want this to happen. And he rather liked the idea of it happening. He said, I wonder if that could happen to me. And sure enough, it happened. Isn't that right? Would you say that out loud, please? The tape recorder's wrong.
That's right.
That's right, yes.
But I didn't want this to happen either. Yes, it did. So,
Doctor, because...
I didn't believe it would happen.
Well, let me just say that I will explain how I was able to achieve that a little bit later, but I would spoil my lesson if I exposed how I did it at this point. So I will get to that. I promise you, in this course, we try not to have any secrets from anybody, because you want to know how it happened, and every doctor in this room wants to know how it happened. The two things that you just saw, they weren't accidents. They weren't accidents at all. After all, I can't afford to stand before a group of people like this as the teacher and make mistakes. Oh, yes, I can afford to have a failure once in a while, because I don't teach any panacea, any elixir. And I can take failures just as easily as any man in this room can take failures. But I couldn't afford to fail very often, and I must have known I was going to get anesthesia here. And I must have known that I could cause temporary amnesia to be able to so adroitly cause the anesthesia on two people in succession and cause the amnesia in the fourth person and miss with the third. Every effect obtainable with a trance state of hypnosis is obtainable on many people with waking hypnosis. In other words, while we've been teaching you to go after the trance state, and surely it's a valuable phase of hypnosis, there are many things that you can do, practically anything you can do with a trance state of hypnosis, that you can do simply by bypassing the trance and not going after the trance at all, and do it without the trance. And that's what I just did. I got anesthesia on two people. Stronger anesthesia than you can get chemically. I got up here on two people. Temporary amnesia I caused. Well, we caused that in somnambulism, so we see that he had the waking state of somnambulism, and yet he has never been hypnotized. You cannot know hypnosis, in my opinion, without knowing how to use waking hypnosis. And in the study of waking hypnosis and waking suggestion, all post-hypnotic phenomena are excluded. Waking hypnosis is not post-hypnotic. It may be achieved on patients who have never known the trance state. And I assure you that the anesthetist here has never known the trance state. Would have probably balked at it if I'd have tried to give it to him. And I can assure you that The gentleman back there probably doesn't know the trance state. Is that correct, sir?
No, I've been.
Oh, have you? Well, I didn't know that. But usually when you say to a person, I'm going to hypnotize you, you generally meet with a lot of resistance. Again and again throughout this course, waking hypnosis is used as a lever to enter the deep trance state with which you will soon be familiar. Your expert knowledge of waking suggestion and waking hypnosis will make of you a better operator in the years ahead. I didn't quite clear up the point I was aiming to clear up, that waking hypnosis is not post-hypnotic. Although the man has been hypnotized, what I did was not post-hypnotic. He was not in any trance, nor did he take that suggestion as a result of post-hypnotic suggestion. He took it as the result of waking hypnosis and nothing else. Now let me show you waking hypnosis at work in group thinking. A whole group of people, such as you, can be hypnotized by the experiment that I'm going to suggest now. In the presence of a number of people, crack and break open a perfectly fresh egg. Make a wry face and exclaim, "Phew, that egg smells rotten. I wouldn't eat that for $1 million. Oh, boy, is that terrible. Smell of that, will you, somebody?" Now you pass that egg around for the people to smell. Person after person will say, "Oh, that egg smells terrible." And some will even say, "Why, it even looks bad." Now, have these sane people gone out of their minds? Not at all. Not at all. They have been hallucinated into believing that the fresh egg is bad. To all intents and purposes, they have been completely hypnotized. Many will contend these people have not been hypnotized, for they were never in the trance state at all. That, says the man who does know nothing about hypnosis. Well, let us examine the facts in the light of your present knowledge. You have learned that hypnosis is a state of mind in which the critical factor of the human is bypassed, thus making selective thinking possible whenever desirable. You have been asked to practice obtaining the trance state on yourself and others in order to increase your ability to urge a suggestion so strongly on your patients that you bypass their critical factors, that is, their ability to judge selected matters accurately, and replace their judgment on these selected matters with your own. When you achieve that interdependent state of mind, you have hypnosis. And now you're learning that you do not need the trance state to achieve actual hypnosis and hypnotic effects. Consider the case of that egg again. When you made the statement, "Phew, that egg smells rotten, I wouldn't eat it for $1 million. Oh, boy, is that terrible." You made a positive statement of apparent fact which your hearers accepted at face value. You bypassed their critical factors, substituting your own. Respect for your judgment caused them to believe what you said even before they smelled the egg. And now note what happened. Having minimized their ability to judge the egg fairly, you asked them to judge the egg. And they judge the egg not with their critical factors, but with yours. They are in a state of mind in which your judgment supersedes theirs. You accomplish hypnosis. You give them the hallucination that a good egg is bad. And the hallucination is so marked that many of them can actually smell an offensive odor. By this simple experiment, you hallucinate two of their senses, that of sight and that of smell. You have hypnosis as effectively as a trance can render it. And here's the odd part. If subsequently the hallucination is not exposed, your hearers will remain convinced to the end of their days that what you showed them and allowed them to smell was an egg in an advanced stage of putrefaction. If you doubt that that experiment will work, try it. And it will work so beautifully for you that you will be amazed and amused at the same time. But remember to keep a straight face while you do it. Let me show you waking hypnosis at work, now not on a group, but on a single individual. If, as a doctor, you were to see a smart-looking nurse in a trim uniform and say to her, "Miss So-and-so, do you mind turning around just once? There's something about that uniform that puzzles me." Once again, you'd set up an amusing episode which will prove the efficacy of waking hypnosis. The nurse follows your instructions, and you gaze at her critically for a moment, and you say, "Mm-hmm. Mm-hmm. Turn around the other way, won't you, please? Mm-hmm. I was wondering what was wrong. Thank you so much. That's all. Good day. Now walk away. You don't have to say anything more.